So simulation is really something that's been around forever, but really started to be understood within healthcare, I'd say maybe in the last 20 years. And it is the opportunity to replicate real life training and real life situations to help people kind of process through the events that they may be facing as they are beginning their careers.
We see all types of learners. We see medical students, residents, fellows, staff. We see nursing, we see respiratory therapists, anesthesia, critical care. We're all over the board.
Simulation is a way to replicate those real life environments and those real life situations in a safe way so we don't harm our patients. We don't introduce concepts on actual humans and patients. We're able to do it in a controlled setting where it's no big deal if we make an error because we can just turn the piece of equipment back on.
People say that they learn from a lot is when they make mistakes. They learn from the mistakes that they made. And we are making mistakes on mannequins. They're not on real people, so that really helps out. When we do a sim, we try to just kind of stand back and let them do whatever they would do in real life. We don't interrupt them. We don't try to correct them or anything like that. We just let them do whatever they would normally do. And then at the end of the simulation, we do a debrief.
And then we can talk about it and discuss and dialogue and learn from our mistakes and understand how we got to those situations.
You really kind of gather all the information that you can find that happened in the sim, analyze it, ask them, why did you do what you did? And then kind of summarize how next time we can do a little bit better, or maybe we did it really well, and next time we're going to do it the exact same way.
There's simulation training or certain content that needs taught within programs such as residencies and fellowships, medical school, nursing school, things like that. And then there's staff who maybe they're struggling in a particular area. I hold planning meetings with them in which I ask them a lot of questions, and then I'll help them build curriculum for their simulations. But first and foremost, it's why are they requesting simulation training? So where is the need? Where is the gap in training, in education?
The Nursing Institute has hundreds of caregivers that we have to put through training. So how can we scale our education to be available to everyone, but also continue to be meaningful for people and enable the educators to literally be able to do it?
We have different level of fidelity mannequins, which means level of realism. So we have some that can bleed, that can cry. Some of them blink. Sometimes their chest actually goes up and down and you can actually see it rising and falling. They have different sounds. They have lung sounds, bowel sounds, heart sounds. You can check pulses. So we just kind of run around and make sure that everything's running correctly. We are in charge of running the mannequins, changing vital signs for the simulation. We voice the mannequin and things like that. So just kind of all the behind the scene things that happen, during a simulation. Maybe they're learning stroke for that day. So we will have a mannequin who has a stroke. Or maybe they're having a heart attack for that day. So then the mannequin will be having a heart attack and we'll adjust the vitals as we need to for that. What else we do though is we do something called in situ, which stands for in the situation. And what we'll do is we'll take these mannequins and we'll load them up and we will go to a hospital, and let's say we're in an ICU, we will go into their setting. So we'll take the mannequin, we'll put it in one of their real beds. And then we can do the same simulation. However, now they're in their own area using their real equipment and are able to, a lot of times what happens is we find ways that they can improve, maybe how they do things, how their unit is set up.
Of course, any time that you can practice over and over on something that's not a live patient, there's no harm on the plastic, practicing on plastic. So that is really what it comes down to.
Of course, when you add the human element into a sim, it makes it interesting and you're not 100% sure what's going to happen. So this really works on the psychomotor skills, right? And at the end of the simulation, we always have them do an evaluation of how they liked it. And most people will tell us that they feel that they learn by doing, not by just like seeing someone else do it or by reading about it or by hearing about it. They like to actually get their hands on it and actually do it. So they tell us that they learn a lot more from actually being able to go through the steps of actually doing it, putting the meds together, giving the meds, actually starting IVs, using the defibrillator and actually using the monitor and having hands on it. They say that they learn a lot more by doing those psychomotor skills that you don't really get when you're just kind of sitting in the classroom listening or reading slides or whatever.
You know, I've been doing this for over 10 years, so I'm an advocate of simulation training, creating that and establishing that safe learning environment that people can practice, experiment, make mistakes, and then be able to sit back and reflect upon that and discuss that in order to learn from those, so that when they are in the clinical environment, they're going to remember those things.
Get the information and be able to process it and figure out why they do the things the way they do and everything. And then they learn a lot more by actually getting a chance to make a mistake and then correcting it, knowing next time they won't make the same mistake again, which could be on like a real patient. So that also helps them learn a lot too.
But healthcare simulation not only teaches people things, but it also can help us as educators and people in healthcare of where might we be falling short? Where do we have gaps? What are some of the processes that could actually be exposing us to risk? So it's kind of evaluative for a learner, for a person, but also for a system and a process.